Good evening. I'm Selwyn Collins of CWS Conversations with Selwyn. Thank you for tuning in. Those of you who are tuning in for the first time, a very special thank you. CWS is about having conversations with people about their journey. How are they using their gifts and talents to help others? How are they making a positive contribution to humanity? So I'm always looking for people who are doing extraordinary things or doing things extraordinarily well. And I encourage conversations because I believe that when we share our stories, we are best connected as human beings. And just imagine telling your story, not just about your successes, but your challenges. How often you got up when you fell. And there's a young person, or anyone, but especially a young person listening to you. And then one day, overcoming their challenges and their limitations because of you, because of what you said, and one day becoming a head of state or someone who stops a genocide, someone who invents a vaccine that saves millions. We never know. And this is why it is so important to give beyond our expectations and give beyond our limitations and give without expectations. Tonight, our guest is Dr. Monica C. Martin, who is an obstetrician, gynecologist, an acupuncturist who also practices traditional Chinese medicine. When I was first introduced to her, I was really moved by it because here is someone who utilizes both Eastern and Western medicine. But I don't want to say too much about it. I want to give Dr. Monica Martin an opportunity to tell her story, to tell her journey, and answer your questions. Dr. Monica Martin is an obstetrician gynecologist in New York. She received her medical degree from State University of New York, Downstate Medical Center, College of Medicine, and has been in practice for 37 years. She's also an acupuncturist and practices traditional Chinese medicine. After graduating from high school, she enrolled in medical school at the University of the West Indies. A trip to Delaware with a family friend opened her eyes to career possibilities in the United States. She transferred to Howard University in Washington, D.C. to earn a bachelor's degree in chemistry before going on to complete a medical degree at Brooklyn SUNY Downstate College of Medicine. Following a 4-year residency with Columbia University and St. Luke's Roosevelt Hospital, Martin spent about a year in the OBGYN service at Harlem Hospital before opening her own office in Hempstead, New York. So I'll take a short break. We are back. Those of you joining us for the first time, I'm Selwyn Collins, your host of CWS Conversations with Selwyn. The lovely lady next to me is Dr. Monica C. Martin. Dr. Martin, good evening.
Good evening, Selwyn. How are you?
I am fine, thank you. And how are you this evening?
I'm very well, thanks.
Well, welcome to CWS.
Thank you so much. It's a pleasure for me.
Dr. Martin, congratulations on all your accomplishments.
Thank you.
And it is a pleasure to have you in CWS.
Thank you
If
so
you
much.
weren't a physician, surgeon, acupuncturist, what would you want to be?
Well, if I didn't become a physician, I would definitely be a linguist. I love languages and I love to communicate with different people, and know that that would have been my second choice, to be an interpreter, something like that.
Is there any language other than English you speak?
Well, I used to be quite fluent in German, but not that much anymore. But I still speak German, and I studied a lot of Spanish, so I still speak Spanish. And of course, I'm studying Chinese,
Mhm.
which I've been studying for quite a while, just because it's so related to my Chinese medical work that I do.
What prompted you to want a career in obstetrics gynecology?
Well, I've always wanted to be a doctor since I remember myself. I've always wanted to be a doctor. And then, when you go to medical school, you have so many choices, and you have to rotate through the different disciplines. dermatology, cardiology. And with me, I liked everyone, but I couldn't be everyone. I wanted to be a surgeon, I wanted to deliver babies, and so I picked OBGYN because I can be a surgeon, I can practice medicine. In fact, medicine of obstetrics, which a lot of people don't realize, is a totally different medicine from regular medicine. For example, a diabetic pregnant woman is a totally different management from a regular diabetic. So I found that fascinating, so I stuck with that.
Um, just hold a second. I think someone asked me, um, mentioned that they're probably not hearing. Is this so with, with anybody else? All right, let's continue. Um, I want to go down your timeline a little bit when
Okay.
you were much younger. Uh, Give us a glimpse into your world as a 12-year-old, um, let's say a 9-year-old, a 15-year-old, and who did you become at 21?
Hmm. Wow. Your questions. Well, I don't remember all of it, but each one of those years that you mentioned were actually significant to me because I remember when I was 9 or an age like that, I had a minor, some procedure I had to do in the hospital, and I remember being so fascinated when I saw the doctors and the nurses at work. I always wanted to be a doctor since I was like, I used to tell my mother since I was 4, and she said since you were 2. But I remember when I was about 9 years old, I was in the hospital for a day or so, and I observed the doctors and the nurses, and I was just so thrilled to see the work they were doing. People were coming in sick, and they're leaving better, or they're being kept in the hospital so that they'll be better. And in a childlike, rudimentary, basic thought process, I was really fascinated.
Mhm.
And I said, wow, this is what I want to do. And when I was about 12, that's when I started high school in Jamaica.
Mhm.
And I was still on this doctor thing, wanting to be a doctor. And people telling me that to become a doctor you have to study Latin and you have to, they used to say, kids used to say all the prescriptions were written in Latin, so you have to know Latin to be a doctor. I went to a school that taught Latin and I just went crazy with Latin. I took it on all the way. My Latin teacher in Canada, I hope she's listening, Norma Lawrence. She had great Latin teachers, but she was one of the greatest of all times. And she made you love that Latin.
Wow.
Because I was going to be a doctor that write prescription in Latin. Of course, we found that not to be true, but the language fascinated me so much, and I am very glad. And I tell you, it's a pity that they don't teach it in schools anymore because it's one of the best languages,
You really enjoyed it.
base language to know. It helps you with every single language, really. And what other age you wanted? 15?
Um, well, since you
Well,
did 12, which is
12
close to
is
15,
12.
who did you become at 21?
21? Well, at 21, I knew I was already in medical school in Jamaica. Because, in the West Indies, they have this procedure where you go straight from high school into medical school. And so that's what I did, straight from high school to medical school. I was in medical school when I got invited by my mom's friend to come to the United States to visit. In fact, the invitation was for my mother. She says, I don't want to go to any America right now. So I came to visit, and then, like they say, the rest is history. I was really, I had a change of heart with the help of Sister Vi, who's the lady I was staying with,
Uh-huh.
to try and pursue the medical career here in the United States. So then I found out the shock of my life that you can't just get into medical school here. You have to go to college first. So that was a big letdown. So I went to Howard University and did chemistry and as my major and mathematics, physics as my minor.
Mm.
Yes. If I was living in America, they would call me, what's the word, geek, nerd?
Oh, really? One of those.
One of those.
So I guess your friends are not surprised by your academic trajectory or your
No,
career
most of
path.
my friends, we were friends because we all were studying together and doing the same thing anyway.
Do you recall any special words of wisdom that you received from your parents that shaped who you are today?
Well, both my parents were they're like my fans. My father was an open fan. He was almost embarrassing. He would just take me up to people and say, she's going to be a doctor one day, you know. She's going to be a doctor one day. And then he would start to tell things about me. And as a child, you know, the mind is being molded.
Mm-hmm.
So you believe everything and you would say, you know, how great I am and how I'm going to do, you know, it's still embarrassing to talk about.
Yes, yes.
But my mom, she was more subtle and she would use the scriptures a lot. She would use the scriptures, she would use Shakespeare. I don't know if she knew she was quoting Shakespeare, but she would quote these things to me. And there's an expression she used to use to me that she used to say, go to the zenith. And before I knew what the word meant, and then she would explain it means the top, the pinnacle. So as a child I kept hearing that, go to the top, go to the pinnacle.
Was she, I presume your mom is deceased.
My mom passed away over a year ago.
Over a year ago.
Yes.
So what was it like for her when you graduated from medical school?
Oh, she was very, very thrilled. She was in Jamaica and she came up for my graduation. I came in from Africa because I was in Africa doing tropical medicine. I came back to graduate from downstate. So my mom came up for my graduation, and downstate actually had a system where they would give honorary medical degrees to your parents. I got an honorary medical degree for her and my brothers, and that was very sweet.
Oh, that's sweet.
Yes,
That's
and
sweet.
so she came up and she was excited for me, but she just kept saying, you were born a doctor." So she was really surprised, but of course she was excited that I graduated.
What skills and personal traits do you think are most important for someone who wants to become an obstetrician gynecologist?
Well, one of the biggest, I think the main attribute is patience and a certain amount of humility. Because if arrogance gets in your way of your work, then your performance will definitely be affected in a negative way.
Patience.
Patience.
Can you tell us what challenge you overcame during medical school or your medical training that you're most proud of?
That I'm most proud of. Well, I told you to give me an idea of the questions you're going to ask, and you didn't.
It's okay. We are back. Those of you joining us for the first time, I'm Selwyn Collins, your host of CWS Conversations with Selwyn. The lovely lady next to me is Dr. Monica C. Martin. Dr. Martin, good evening.
Good evening, Selwyn. How are you?
I am fine, thank you. And how are you this evening?
I'm very well, thanks.
Well, welcome to CWS.
Thank you so much. It's a pleasure for me.
Dr. Martin, congratulations on all your accomplishments.
Thank you.
And it is a pleasure to have you in CWS.
Thank you
If
so
you
much.
weren't a physician, surgeon, acupuncturist, what would you want to be?
Well, if I didn't become a physician, I would definitely be a linguist. I love languages, and I love to communicate with different people, and I know that that would have been my second choice, to be an interpreter, something like that.
Is there any other any language other than English you speak?
Well, I used to be quite fluent in German, but not that much anymore, but I still speak German. and I studied a lot of Spanish, so I still speak Spanish.
Okay.
And of course, I'm studying Chinese,
Mhm.
which I've been studying for quite a while, just because it's so related to my Chinese medical work that I do.
What prompted you to want a career in obstetrics gynecology?
Well, I've always wanted to be a doctor
Mhm.
since I remember myself. I've always wanted to be a doctor. And then, when you go to medical school, you have so many choices, and you have to rotate through the different disciplines: dermatology, cardiology. And with me, I liked everyone, but I couldn't be everyone. I wanted to be a surgeon, I wanted to deliver babies, and so I picked OBGYN because I can be a surgeon, I can practice medicine. In fact, the medicine of obstetrics, which a lot of people don't realize, is a totally different medicine from regular medicine. For example, a diabetic pregnant woman is a totally different management from a regular diabetic. So I found that fascinating, so I stuck with that.
Um, just hold a second. I think someone asked me, um, mentioned that they're probably not hearing. Is this so with anybody else? All right, let's continue. Um, I want to go down your timeline a little bit when
Okay.
you were much younger. Uh, Give us a glimpse into your world as a 12-year-old, um, let's say a 9-year-old, a 15-year-old, and who did you become at 21?
Hmm. Wow. Your questions. Well, I don't remember all of it, but each one of those years that you mentioned were actually significant to me, because I remember when I was 9 or an age like that, I had some procedure I had to do in the hospital, and I remember being so fascinated when I saw the doctors and the nurses at work. I always wanted to be a doctor since I was like, I used to tell my mother since I was 4, and she said since you were 2. But I remember when I was about 9 years old, I was in the hospital for a day or so, and I observed the doctors and the nurses, and I was just so thrilled to see the work they were doing. People were coming in sick, uh, and they're leaving better, or they're being kept in the hospital so that they'll be better. And in a childlike, rudimentary, basic thought process, I was really fascinated.
Mhm.
And I said, wow, this is what I want to do. And when I was about 12, that's when I started high school in Jamaica.
Mhm.
And I was still on this doctor thing, wanting to be a doctor. And people telling me that to become a doctor you have to study Latin, and you have to, they used to say, kids used to say all the prescriptions were written in Latin, so you have to know Latin to be a doctor. I went to a school that taught Latin, and I just went crazy with Latin. I took it on all the way. My Latin teacher in Canada, I hope she's listening, Norma Lawrence. We had great Latin teachers, but she was one of the greatest of all times. And she made you love that Latin.
Wow.
Because I was going to be a doctor that write prescription in Latin. Of course, we found that not to be true, but the language fascinated me so much, and I am very glad. And I tell you, it's a pity that they don't teach it in schools anymore, because it's one of the best languages,
You really enjoyed it.
base language to know. It helps you with every single language, really. And what other age you wanted? 15?
Um, well, since you
Well,
did 12, which is
12
close to
is
15,
12.
who did you become at 21?
21? Well, at 21, I knew I was already in medical school in Jamaica. Because, in the West Indies, they have this procedure where you go straight from high school into medical school. And so that's what I did, straight from high school to medical school. I was in medical school when I got invited by my mom's friend to come to the United States to visit. In fact, the invitation was for my mother. She says, I don't want to go to any America right now. So I came to visit, and then, like they say, the rest is history. I was really, you know, I had a change of heart with the help of Sister Vi, who's the lady I was staying with, to try and pursue the medical career here in the United States. So then I found out the shock of my life that you can't just get into medical school here. You have to go to college first. So that was a big letdown. So I went to Howard University and did chemistry and as my major and mathematics, physics as my minor.
Mm-hmm.
Yes. If I was living in America, they would call me, what's the word, geek, nerd?
Oh, really? One of those.
One of those.
So I guess your friends are not surprised by your academic trajectory or your
No,
career
most of
path.
my friends, we were friends because we all were studying together and doing the same thing anyway.
Do you recall any special words of wisdom that you received from your parents that shaped who you are today?
Well, both my parents were they're like my fans. My father was an open fan. He was almost embarrassing. He would just take me up to people and say, she's going to be a doctor one day, you know. She's going to be a doctor one day. And then he would start to tell things about me. And as a child, you know, the mind is being molded.
Mm-hmm.
So you believe everything, and you would say, you know, how great I am and how I'm going to do, you know, it's still embarrassing to talk about.
Yes, yes.
But my mom, she was more subtle, and she would use the scriptures a lot. She would use the scriptures, she would use Shakespeare. I don't know if she knew she was quoting Shakespeare, but she would quote these things to me. And there's an expression she used to use to me that she used to say, go to the zenith. And before I knew what the word meant, and then she would explain it means the top, the pinnacle. So as a child I kept hearing that, go to the top, go to the pinnacle.
Was she, I presume your mom is deceased.
My mom passed away over a year ago.
Over a year ago.
Yes.
So what was it like for her when you graduated from medical school?
Oh, she was very, very thrilled. She was in Jamaica and she came up for my graduation. I came in from Africa because I was in Africa doing tropical medicine. I came back to graduate from downstate. So my mom came up for my graduation, and downstate actually had a system where they would give honorary medical degrees to your parents. I got an honorary medical degree for her and my brothers, and that was very sweet.
Oh, that's sweet.
Yes,
That's
and
sweet.
so she came up and she was excited for me, but she just kept saying, you were born a doctor." So she was really surprised, but of course she was excited that I graduated.
What skills and personal traits do you think are most important for someone who wants to become an obstetrician gynecologist?
Well, one of the biggest, I think the main attribute is patience and a certain amount of humility. Because if arrogance gets in your way of your work, then your performance will definitely be affected in a negative way.
Patience.
Patience.
Can you tell us what challenge you overcame during medical school or your medical training that you're most proud of?
That I'm most proud of. Well, I told you to give me an idea of the questions you're going to ask, and you didn't.
It's okay. We are back. Those of you joining us for the first time, I'm Selwyn Collins, your host of CWS Conversations with Selwyn. The lovely lady next to me is Dr. Monica C. Martin. Dr. Martin, good evening.
Good evening, Selwyn. How are you?
I am fine, thank you. And how are you this evening?
I'm very well, thanks.
Well, welcome to CWS.
Thank you so much. It's a pleasure for me.
Dr. Martin, congratulations on all your accomplishments.
Thank you.
And it is a pleasure to have you in CWS.
Thank you
If
so
you
much.
weren't a physician, surgeon, acupuncturist, What would you want to be?
Well, if I didn't become a physician, I would definitely be a linguist. I love languages and I love to communicate with different people, and know that that would have been my second choice, to be an interpreter, something like that.
Is there any language other than English you speak?
Well, I used to be quite fluent in German, but not that much anymore. But I still speak German, and I studied a lot of Spanish, so I still speak Spanish. And of course, I'm studying Chinese,
Hmm.
which I've been studying for quite a while, just because it's so related to my Chinese medical work that I do.
What prompted you to want a career in obstetrics gynecology?
Well, I've always wanted to be a doctor since I remember myself. I've always wanted to be a doctor. And then, when you go to medical school, you have so many choices, and you have to rotate through the different disciplines: dermatology, cardiology. And with me, I liked everyone, but I couldn't be everyone. I wanted to be a surgeon, I wanted to deliver babies. And so I picked OBGYN because I can be a surgeon, I can practice medicine. In fact, the medicine of obstetrics, which a lot of people don't realize, is a totally different medicine from regular medicine. For example, a diabetic pregnant woman is a totally different management from a regular diabetic. So I found that fascinating, so I stuck with that.
Mhm. Um, just hold a second. I think someone asked me, um, mentioned that they're probably not hearing. Is this so with anybody else? All right, let's continue. Um, I want to go down your timeline a little bit when you
Okay.
were much younger. Uh, Give us a glimpse into your world as a 12-year-old, um, let's say a 9-year-old, a 15-year-old, and who did you become at 21?
Hmm. Wow. Your questions. Well, I don't remember all of it, but each one of those years that you mentioned were actually significant to me, because I remember when I was 9 or an age like that, I had some procedure I had to do in the hospital. And I remember being so fascinated when I saw the doctors and the nurses at work. I always wanted to be a doctor since I was like, I used to tell my mother since I was 4, and she said, since you were 2. But I remember when I was about 9 years old, I was in the hospital for a day or so, and I observed the doctors and the nurses, and I was just so thrilled to see the work they were doing. People were coming in sick, uh, and they're leaving better, or they're being kept in the hospital so that they'll be better. And in a childlike, rudimentary, basic thought process, I was really fascinated.
Mhm.
And I said, wow, this is what I want to do. And when I was about 12, that's when I started high school in Jamaica.
Mhm.
And I was still on this doctor thing, wanting to be a doctor. And people telling me that to become a doctor, you have to study Latin, and you have to. They used to say, kids used to say all the prescriptions were written in Latin, so you have to know Latin to be a doctor. I went to a school that taught Latin, and I just went crazy with Latin. I took it on all the way. My Latin teacher in Canada, I hope she's listening, Norma Lawrence. She had great Latin teachers, but she was one of the greatest of all times. And she made you love that Latin.
Wow.
because I was going to be a doctor that write prescription in Latin. Of course, we found that not to be true, but the language fascinated me so much, and I am very glad. And I tell you, it's a pity that they don't teach it in schools anymore, because it's one of the best languages,
You really enjoyed it.
base language to know. It helps you with every single language, really. And what other age you wanted? 15?
Well, since you
Well,
did 12, which is
12
close to
is
15,
12.
who did you become at 21?
21? Well, at 21, I know I was already in medical school in Jamaica. Because, in the West Indies, they have this procedure where you go straight from high school into medical school. And so that's what I did, straight from high school to medical school. I was in medical school when I got invited by my mom's friend to come to the United States to visit. In fact, the invitation was for my mother. She says, I don't want to go to any America right now. So I came to visit, and then, like they say, the rest is history. I was really, you know, I had a change of heart with the help of Sister Vi, who's the lady I was staying with,
Uh-huh.
to try and pursue the medical career here in the United States. So then I found out the shock of my life that you can't just get into medical school here. You have to go to college first. So that was a big letdown. So I went to Howard University and did chemistry and as my major, and mathematics, physics as my minor.
Mhm.
Yes. If I was living in America, they would call me, what's the word, geek, nerd?
Oh, really? One of those.
One of those.
So I guess your friends are not surprised by your academic trajectory or your
No,
career
most of
path.
my friends, we were friends because we all were studying together and doing the same thing anyway.
Do you recall any special words of wisdom that you received from your parents that shaped who you are today?
Well, both my parents were they're like my fans. My father was an open fan. He was almost embarrassing. He would just take me up to people and say, she's going to be a doctor one day. She's going to be a doctor one day. And then he would start to tell things about me. And as a child, the mind is being molded.
Mm-hmm.
So you believe everything, and you would say, how great I am and how I'm going to do. It's still embarrassing to talk about.
Yes, yes.
But my mom, she was more subtle, and she would use the scriptures a lot. She would use the scriptures, she would use Shakespeare. I don't know if she knew she was quoting Shakespeare, but she would quote these things to me. And there's an expression she used to use to me that she used to say, go to the zenith. And before I knew what the word meant, and then she would explain it means the top, the pinnacle. So as a child, I kept hearing that. Go to the top, go to the pinnacle.
Was she, I presume your mom is deceased.
My mom passed away over a year ago.
Over a year ago.
Yes.
So what was it like for her when you graduated from medical school?
Oh, she was very, very thrilled. She was in Jamaica and she came up for my graduation. I came in from Africa because I was in Africa doing tropical medicine, and I came back to graduate from downstate. So my mom came up for my graduation, and downstate actually had a system where they would give honorary medical degrees to your parents. I got an honorary medical degree for her and my brothers, and that was very sweet.
Oh, that's sweet.
Yes,
That's
and
sweet.
so she came up and she was excited for me, but she just kept saying, "You were born a doctor." So she wasn't really surprised, but of course she was excited that I graduated.
What skills and personal traits do you think are most important for someone who wants to become an obstetrician gynecologist?
Well, one of the biggest, I think, the main attribute is patience
Mhm.
and a certain amount of humility. Because if arrogance gets in your way of your work, then your performance will definitely be affected in a negative way.
Mm. Patience.
Patience.
Can you tell us what challenge you overcame during medical school or your medical training that you're most proud of?
What I'm most proud of. Well, I told you to give me an idea of the questions you're going to ask. And you didn't.
It's okay.
uh, I'm most proud of the fact, if we can use the word proud, but I'm very happy that I overcame a lot of racism that was in that school. I'm sure they're probably probably listening to me, but it's the truth. You could cut the racism with a knife.
Is that so?
Yes, and it's a system. I guess not just that school, but it's a system that tries to make you not believe in yourself.
Mhm.
But I do believe that when you have that basic upbringing of believing in self, it's very hard for people along the way to stop that. So I held on to believing in what I can do and what my abilities were. And so I never did really let that bother me in any way. I knew it was happening, but I didn't let it bother me, like made me not perform because I already knew what I was about.
Talking about gynecology, what are some questions you believe need to be asked that women, especially young girls, are not bothering to ask?
Hmm. That's a tough question, but I'll answer it. There are many questions that need to be asked by everyone, especially a lot of young people. I don't think a lot of people are aware of the importance of, or the detriment, or the gravity of sexually transmitted disease. Sexually transmitted disease is really a travesty, and if it's understood a little better, it will be less detrimental to society. If people would understand that sexually transmitted disease is real and that organisms are real and your reproductive system serves like a culture medium for certain organisms. And when these organisms infect or affect your reproductive system, it can affect a lot of things about you, including your reproduction, of course. And so, a woman, for example, who got infected at age 16 with a certain type of disease, can go through her life fighting infertility. And a lot of times, unfortunately, doctors don't explain to the woman that her infertility that happened to her 10 years ago or 20 years ago, which I think is important so she can at least know for her own self and also teach others to avoid these pitfalls.
And what tests and screenings do a woman need each year, and how often should she get a pap smear?
Well, I still recommend the pap smear every year, but the um, American College of Acupuncture and the American Medical Association, they're kind of pushing to have pap smears every 3 and sometimes every 5 years. Um, I I see some wisdom in that if a woman has been having normal pap smear all along, chances of her just developing cancer in the next year is not likely. But what I like about having women come in every year evaluated. See, when I see my patients, I don't just do a gynecologic exam. A lot of women don't have a physical exam. A lot of women don't have a medical doctor. So when they come to me, for example, and a few other GYN doctors, we do a full physical exam. I can still pick up heart murmurs, even though I'm supposed to be working below the waist.
Right.
I can still pick up heart murmurs. I can pick up problem with the liver. I can pick up problem if their eyes look kind of strange. Maybe they're having something with their gallbladder, or they're having some kind of anemia. There's so many things we can do for a patient if she comes in every year. So I still recommend every year for the physical exam, but they come in for their pap smear, so to speak, and I do their pap smear. But even if it were for the pap smear, I think somebody should be in contact with a medical professional at least once a year.
How do you? Well, someone asked me to ask you this question. How do you treat uterine fibroids? Is that a fair question?
That's a fair question, especially for me, and that's one of my main work that I do. Because uterine fibroids affect a lot of women, especially black women. Okay, um, we don't know the exact reason, but maybe it has to do with diet, food. You know, that a lot of the foods are kind of laced with hormonal stuff, and the hormones tend to trigger the growth of fibroids. But officially, the answer to that is we don't know why fibroids come about. But when they do come about, the management of fibroids often has to do with the woman's, I wouldn't say age, it's the woman's desire for childbearing, the way you manage those fibroids. Because a lot of people just do hysterectomy right away for fibroids. But I was trained a little differently to be conservative and try to save the uterus. And so I do what's called a myomectomy instead of a hysterectomy. And the myomectomy means you're removing the myomas. Each fibroid, the other medical name for it is myoma. So I do myomectomy. And you do a myomectomy in a very conservative way so that you can preserve the woman's uterus for the possibility of childbearing. Some women just do not even want to have another child, but the fact still remains, if you're going to do a myomectomy, you have to do it well, so that the woman's uterus, the integrity of the woman's uterus is kind of intact. So whether or not she wants to have a child, she has an intact uterus that's put together nicely and sits in her abdomen really well and not cause her pain and discomfort along the way.
Talking about childbearing, how are abortions on a woman's body?
Abortions, there are different types of abortions. You have the abortions, but in the medical world, we call miscarriages. The medical word for it is abortion, meaning you have aborted.
Yes.
But the regular world think of abortion as something you wish on yourself. Right? So an abortion, or what we call a voluntary abortion, voluntary termination of pregnancy, can take many forms, because you can have an abortion very early, 6 weeks, 4 weeks, once you find out you're pregnant. And a lot of times those abortions have very little impact on the body. But I hasten to correct that by saying it depends on who does these abortions. Because if it's not in the hands of somebody who really know what they're doing, then they can cause havoc on the woman's uterus. When you go in that cavity of the uterus to take out that fetus, you could create scarring. So if you're having an abortion, you should go to somebody who really is proficient at it. And then you have abortions at different levels of pregnancy. You have the abortion where you can just go in and use what they call a curette, and you remove or suction the poop. Should we go on?
Sorry?
Should we go on?
Yes.
People get turned up.
No, I mean...
you can suction out the fetus, or you can, if it's older, then you can have a procedure where the patient, you sort of initiate a spontaneous abortion where the woman expels the fetus.
Do you have any advice for women who are pregnant?
Well, in general, pregnancy can go from 1 week to 9 months. So in that whole sphere of pregnancy, the most important thing is to take good care of yourself. Because for the time being, you are the home where this fetus is going to live. So if you have a baby inside you and you're smoking and you're drinking and you're cursing and swearing and you have bad thoughts, then all those things affect the fetus. If you have negativity, stress, worry a lot, it affects your baby. Everything affects the baby.
You mentioned negativity and energy and thoughts, and I am drawn to that other aspect of your profession, acupuncture and traditional Chinese medicine. Who in your family, if any, was involved in healthcare, and was your mother or grandmother a healer?
My grandmother's father, from what I understand, was a doctor. He used to deliver babies, but I never did get to explore it because I found out so late. But I know the medical. Um, there are few people in my family who are medical people. There's some younger people in Jamaica that I have found out from my father's side who are physicians, and from my mother's side. And people, I'm a formally trained doctor,
Mhm.
but when you look way back, people are always trying to heal. So I grew up with a grandmother who was always picking the bush and rubbing it on and healing. So that can be in the blood too.
I want to ask you a question because I want to um, create a sort of bridge between your practice of Western medicine and Eastern medicine.
Okay.
But I'd like to give you the opportunity to introduce us to your upbringing and what you might have been exposed to while being raised in the Caribbean and Jamaica specifically. Tell us some things that you might have witnessed, might have observed, might have been exposed to that led you to believe that there are alternatives.
Yes, you're from the Caribbean, I'm from the Caribbean. We all know alternatives. We all know that there are people in our family that would cure us from certain things without taking us to the doctor. We know that.
Yes.
And so, as I said, when you're a child, you don't even know how much you're absorbing. But I do recall as a young girl, when I was in high school, that I used to be fascinated with the other aspect of medicine. Because a lot of medicine, Western medicine, still to this day, come from herbs. A lot of the chemotherapies come from come from plants. A lot. Because the drug companies make it sound so fancy. But tamoxifen, which is one of our modern chemotherapy drugs, is a herbal medicine. Vincristine, vinblastine, these are big time, very expensive chemotherapy, come from periwinkle. Penicillin came from, mushroom. It's very old stuff. So, but as a child, I remember I used to try to sneak into the University of the West Indies with my friend. We used to go in, and she did literature, my friend Barbara, which she could be listening, and she was always into her literature. And then I would go to the university with her when she used to go and study Shakespeare and those things, and I would sneak down to the science library, and then I would borrow these books. Maybe they thought I was a student. I would borrow these books, and I would take them home and study plants. And I can't believe this. A plant can do that, and I was very fascinated with that. But these are things I kept to myself, My mother knew that I was always borrowing these books, and she'd take the people's book back. What are you doing with this book, But I was very thrilled by the fact that plants can do so much. So one thing kind of led to another, where I started to study and look into Chinese herbs, and then I was fascinated with ginseng, white ginseng, and all these things. And then I came across a company that does Chinese medicine, and so I joined up with them. Many years now I've been working with this company, and we do a lot of herbs, pure authentic Chinese herbs. And then I guess getting involved in that level of Chinese medicine, I was fascinated by acupuncture. Acupuncture is another very long story. We wouldn't have time for this show. But
You'll be coming back, so that's fine.
I happened up on acupuncture, and one thing to another, I went to China and got to see a little more of what they do, and I was just amazed. It was just the most amazing thing to see. Stroke patients just walking out, it's just something to see. I say I'm sold. So since then, I've been doing acupuncture, which is like over 20 years.
Over 20 years. Let me just go to the chat room for a second. G asked, "Are you a proponent of the HPV vaccine? If so, why?"
Well, very, very, very good question. I have not really advocated for it,
Hmm.
um, only because I'm not too sure about it. I won't say too much, but I have not really advocated for it. The HPV is a very dangerous virus, so it's something where if it's explained to the person and they want to take the vaccination, then there's a some amount of wisdom in doing that
Okay.
as a prevention if you're really sexually active.
And Kali said, "Dr. Martin, thank you for being on the program. What types of ailments would acupuncture be better suited as a therapy?"
Well, in this side of the world, the Western world, they think of acupuncture as something for pain, and it's wonderful for pain. But when you really study acupuncture, for example, I was in China, central China, and we worked in a clinic there, University of Chengdu, and they literally treat almost everything: high blood pressure, heart disease, diabetes, and here I do some acupuncture for other things. When I do acupuncture, I don't just treat pain. So the standard thing that most people know is the joint pains, the headaches, the migraine. Acupuncture is just remarkable for that.
Mhm.
But there's certain other diseases that acupuncture works very well for.
And Kali asked, "Which cultures do you admire for how they practice medicine?"
Wow, very interesting.
I have an interesting audience here.
Yes, that's very interesting. Yes. Well, I'm a little biased, but I admire the China. Well, obviously, I'm trained here, so I
Yes.
admire Western medicine. It when practiced well, it is really fascinating and interesting, and can be very deep in terms of the knowledge.
Mhm.
Some aspects of it, however, are abused. But what I admire about the Chinese is how they believe that the body can really cure itself. I find that in Western medicine, I have to say we, because I'm a Western doctor, we jump a lot to take things out and fix things. I mean, for emergencies, you can understand, but the body doesn't get a chance to sometimes heal itself. A lot of heavy drugs are given to people, and these drugs cause side effects. And the drug companies, they wait and then they tell you, oh, this could cause a side effects, but that's like years after the drug is out there. People are not told when the drug comes out that this could cause this or this could cause that. So unfortunately, people experience the side effects and then there's a recall or whatever. So I admire the fact that the Chinese embrace a lot of Western medicine, mind you, because when I was there, across the street was a Western hospital. So they really embrace Western medicine,
Mhm.
but they believe in combining them. And the Chinese people, they embrace it, and it was very interesting to watch them leave from the Western side hospital to come over to us on the Chinese side to get another opinion or whatever.
But how did you become involved with weaving traditional Chinese medicine into, or natural traditional Chinese medicine into Western medicine?
How did I?
How did you get involved into weaving the two?
Oh, okay, combining the two.
Mm-hmm.
Well, because it makes so much sense, you know. When I went into medicine, and every doctor, I hope, go into medicine to make people feel better. So it's very simple. Um, One medicine alone sometimes doesn't do the trick. And so, for example, if I have a patient coming to me and she's suffering from, let's say, endometriosis, which I don't know if you know that disease, very painful disease, and you're going to admit the patient to the hospital to do laparoscopy or abdominal surgery in another day or two. I do acupuncture on the woman, and she gets to go home, relax, talk to her family, pack her bag, and come to the hospital the next 2 days. Whereas when the patient is doubling over in pain, you have to send her to the hospital in an ambulance. So I get to quiet the pain, and then I still do my Western thing.
Hmm. G asked, how do you use Chinese herbs in your practice? Is there an herb that is useful for, say, HPV?
Well, I work with there's a company I work with, and the herbs they have, they're traditional Chinese medicine, but they're packaged kind of Western looking. They're in caplet forms and capsule forms. And there are numerous herbs. You know, we have all the different ginsengs, we have the different tonics, we have the herbs that work for the joints, we have the herbs that work for diabetes, and we have teas that clean the blood and clean the system. And so it's very, it's packaged really nicely, and patients get to go home and open them. It's not almost like they're dealing with Western medicine, but it's not. And I give them the instructions, and it's been many years of that, and they all seem happy. We have multivitamins. A lot of people don't nourish their bodies well, so a very wonderful multivitamins that addresses different aspects of the body's needs. Like minerals and stuff that are missing that you don't get from our regular food.
How do you deal with patients who doubt the effectiveness of acupuncture?
Well, how do I deal with them in terms of how I approach? I don't argue about acupuncture. Acupuncture is 5,000 years old. So I don't argue. If anybody doesn't believe, I don't know, I would know where to start. I would try to educate them. But you don't argue with something that's 5,000 years old and still going on.
I want to ask you this question and take a quick break.
Yes, sir.
What are some common fears and myths about acupuncture?
Well, the fears that people obviously have with the needles. I'm being stuck by a needle. But if it's any consolation, it's not like the needle that's used to draw blood. It's a very tiny, in fact, we refer to it as filamentous. That means it's like a little filament of a needle. And because it's so tiny, when the needle is going in, most people really don't feel it. They feel a sensation because there's a sensation which we call the chi. And that sensation is really almost like a reassurance for the doctor doing it that, yes, I'm in the right spot. That's really what that means to the doctor, even though the patient might say, ouch, So it's a lot of fun for me, and patients get a lot of good results, and they seem to love it. So.
Let's take a quick break.
Yes, sir.
We are back with Dr. Monica Martin. Dr. Martin,
Yes.
do you believe that younger Caribbeans embrace alternative medicines as much as their ancestors?
Younger Caribbean people that live here or back in the
Well,
West Indies?
you know what? Let me reframe the question. Younger Caribbeans throughout the diaspora and within the Caribbean, do you think they embrace alternative medicine as much as their foreparents?
Well, I don't think so. I actually, they don't. The reason is kind of obvious because a lot of times in the case of our ancestors, people before us, it was a case of necessity being the mother of invention. In this world, we have medicine, we have emergency rooms, we have doctor's offices to run to, every little thing. And so, I don't think the younger people would even bother to explore. I don't think they would even bother to explore what alternative medicine, which means West Indian medicine. You know, we have a lot of herbs in the West Indies.
Yes.
The African, in Africa, they have a lot of herbs, you know, that they use there too. But I don't know as a fact, but I don't think that they would embrace as well as or as much as our.
What do you think can be done in the Caribbean to encourage that? The embrace of not only traditional Chinese medicine, but also acupuncture?
Well, the traditional medicine, if the doctors, the Caribbean doctors, they know that a lot of the herbs, for example, in Jamaica, are used towards medical purposes. If that knowledge would get out there, then people would start to have a little more respect for the alternative medical treatments. Acupuncture is a little different in that its origin is Chinese. I know they're doing acupuncture in Jamaica now, and it takes a while for things to pick up. America tends to lead the way, and acupuncture has really taken off in America. So I find that in the Caribbean it will definitely.
Any advice for young doctors who are young medical students who wish to pursue a career in acupuncture?
Well, I have a few medical students who come to me as patients, and I always encourage them to go into acupuncture, to do it, even just to do it, just for the knowledge, just to understand it. Um, it's the anatomy of the human anatomy is so fascinating, and when you pursue acupuncture, you get to see the whole body all over again. I had to study the whole body again when I went into acupuncture.
What surprised? Sorry, go ahead.
Go ahead.
No, the question I was going to ask you: what surprised you the most about what you discovered about the human body when you were studying acupuncture?
When I was studying acupuncture, I was very fascinated about what they call the meridians, the meridians or the pathways of energy that come from the different organs of the body. For example, the kidney meridian going down the legs, and the heart meridian running down the arm. There's certain meridians that make more Western sense, like the heart meridian run, you know, when people get a heart attack, they say, oh, it ran down my arm, I feel the pain on my arm. So that aspect of it is understandable. But there are certain things that really baffled me when, for example, the first lecture I went in China in acupuncture, and the professor was talking about the kidney and he's pointing down at his ankle. And I'm like, excuse me, the kidney's in your back, you know. But then I got to find out that the whole body is just one entity, and acupuncture helps you to have a better grasp of the body.
Having studied Western medicine and studied the anatomy before, knowing what you know now, do you think you might have been better off starting with acupuncture first and then going into Western medicine?
No, not really.
Not really.
Not the way we did medicine at Downstate. I think Downstate, the way we did anatomy, I don't think there's another medical school that did it to that extent, and it was very deep, and I got to learn a lot from the anatomy labs, so I wouldn't trade that for anything.
I want to slip into the chat room a bit. AB asked, are Chinese herbs FDA approved prior to your recommendations and use?
A lot of the Chinese medicines are not, a lot of things are not FDA approved. A lot of things people are taking, they think it's FDA approved, but it's not. So the FDA hasn't really approved a lot of the, like the ginsengs and all that. It's not really officially approved.
And Jean or Jean asked, are there certain types of individuals who are better suited for acupuncture therapy? Does one have to believe for acupuncture to be effective?
Well, you know, they have an expression, believe cures and so on. But if you think of believing in acupuncture, you have to wonder how come veterinary acupuncture works. You know, you have acupuncture for animals, dogs and cats, and it works. So no, I don't believe it's the belief that really works. But in general, even in Western medicine, if somebody comes to me and they have no belief in what I'm gonna do, I don't like that, because it seems to me like it's a partnership, and when they work with me and I work with them, it's better. But it doesn't mean that because they don't believe the surgery that I'm gonna do is gonna work. For example, when somebody comes to the emergency room and they need surgery right away, whether they believe or not, somebody's taking them to the OR and they're getting the surgery done and they're gonna be better the next day or whatever. So that thing of believing, I understand the question, but it's very, very tricky to look at it that way, because acupuncture has been really studied, and even the Western medicine, Western world has really gone into. In fact, when I went to China, there were some people from the United States government that came with us because they were trying to get it approved here, because acupuncture recently got approved for billing and so on. You can get the insurance to pay for it and all that. So they had to really know that it worked before they got that far with it.
In your practice, when do you use acupuncture and herbs versus Western medicine and surgery?
Well, there are certain things that people come for on a regular basis, come to me for on a regular basis. Let's say somebody has chronic back pain and they have had all the MRIs and all the physical therapy and everything, and there's a point where there's nothing else to do. They come to me and they get their acupuncture treatment right there in the office. Certain joint pain, certain basic things. I combine my Western medicine with my Eastern, because you don't want to jeopardize the patient's health in any way. If somebody has diabetes, you want to get them checked, and you want to make that diagnosis properly, and you want to get them treated. You can give acupuncture to sort of enhance the treatment, but you cannot sit here and let somebody's blood sugar go through the roof because you're trying to see how acupuncture is going to work. So it takes a lot of wisdom and common sense when you do this combination.
Alan asked, for most people, acupuncture may feel risky because they don't know much about it.
Yes.
And finding a practitioner might feel a little like gambling. Can you advise us?
Well, if you're finding a practitioner, it's best to find a practitioner that's licensed in the state that you are in, because those people have to go through exams. I'm a physician, but there are people who are non-physicians who are doing acupuncture. I can't personally tell you how good they are, because I haven't really worked with them. But if you get someone that's recommended, there are hospitals that have embraced acupuncture, and most of these people are well qualified, and you could actually go to them and feel comfortable.
What type of patient do you work best with, and which patients get the best results?
You mean physically or?
Well, let's try physically.
Physically, the patients that I work best with, it's very difficult to answer that question, because I try to, there's a side of me that gets turned on to everything that comes my way. So I feel I try to do my best for everyone, for everything I try to do. So I can't say the person with pelvic inflammatory disease, I feel better about treating them than the person with fibroids. Because the person with pelvic inflammatory disease, I'm going to put on my pelvic inflammatory disease hat for them. Okay, so when you do this kind of work, you have to be, equipped to manage all aspects of your work.
Tell us a success story using acupuncture.
Wow, there are so many. There's so many. There's one lady who lives in Maryland. I say lives because years ago she was in hospice waiting to die, and she had a cancer, lymphoma, and she was getting her regular chemo and treatments that were needed, but she and her family had the wisdom to embrace acupuncture also. So I would do that. So while she had her treatment, she didn't get nausea, she didn't get the vomiting that goes with the chemo. And her oncologist was actually so surprised at how she responded. And I warned her to keep up with her Western treatments, and she would come every 2 weeks for her acupuncture. And God knows why, but she's alive to this day, doing very well. And we spoke not too long ago. And there are many such cases.
Someone in the audience asked you just now how to advise us in terms of looking for an acupuncturist. But I have a more direct question.
Yes.
What separates you from other acupuncturists? Or what makes you different?
I've not thought of myself as different. Am I different?
I don't know. What?
Well, what makes me different, maybe, there are not too many MDs that do acupuncture.
Here we go.
When I started to do acupuncture, my colleagues laughed at me, and I was kind of laughing at myself too, like, why am I doing this thing, you know? And I went to China, and what's that, you know? Why are you doing that? Because I was very, very busy obstetrician, delivering babies night and day, but I was just curious, and now that I've done it, I'm so happy I embraced it, and maybe that makes me different. There are some doctors in the hospitals that do acupuncture for pain management, mostly anesthesiologists. But the hospitals may have one here and one there. I understand that Sloan Kettering has now started to use acupuncture to help their some of their cancer patients and so on. But I have fully embraced acupuncture, and I have fully embraced Western medicine, and maybe that makes me different.
What do you think is the biggest healthcare challenge for women today? Or one of?
The biggest healthcare challenge, I would say, might be a very awkward answer, but I think it's lack of knowledge.
Lack
of knowledge. What did the Bible say about that? My people perish from lack of knowledge. The lack of knowledge is one of the biggest obstacles to health in general, not just to women. Because, for example, if you look at smoking, if people really had knowledge about smoking, would they smoke? Never. It's so disastrous and deleterious for the body. But they just smoke. All they see is I'm pulling in smoke and I'm blowing out smoke. But they don't. If they only knew what was going on with these cells in their bodies and what's going on with their kidney and their liver, they would never smoke. So lack of knowledge causes a lot of pain in our society. You know, we have television, but television doesn't give knowledge. Television gives jokes and entertainment and humor, which is good. I love entertainment. I love to laugh too, but the human body is very important. That's all we've got. And I do believe that if there was more information so people would understand better and not make it look, oh, you know, have to go to the doctor. The doctor is important, but the doctor is not going to share knowledge because doctors are not talking people. They're silent people.
Do you see women with abnormal pap tests, and how do you counsel them, if you do?
Well, the nice thing about the fact that pap smear even exists, it's one of the biggest miracles of life, because this gentleman, Dr. Papanicolaou, I don't know if people know it's a name. It's a gentleman's name, you know. They used to call him Dr. Pap.
Oh, really?
Yes.
I didn't know.
And he was just playing around in the lab and found that, look, we can find cancer cells falling off the cervix like this. Otherwise, like all the other organs of the body, we wouldn't know how to find cancer. Because up to the 60s, women just died from cancer of the cervix. So pap smear is extremely important. And the nice thing about the pap smear is that if a problem is caught early, you can treat it. It's a piece of cake. You can just treat it in the office. Before it becomes cancerous.
What is most rewarding about being an acupuncturist?
Wow, everything.
Everything. I want to take you somewhere, or invite you to take us somewhere.
Okay.
You're a physician, Western medicine. You studied acupuncture. You
Yes.
studied Chinese, traditional Chinese medicine in China and so on. Have you ever had an experience, and well, Oprah loves to use this aha thing, but have you ever had an aha experience that really fascinated you, that really made you look at, I'm gonna go here. Look at Western medicine differently. Have you ever had that sort of experience? Like, wow, I did not know this is possible.
I've had a lot of those actually, quite a lot.
Can you share one with
Well, I
us?
had a woman years ago um, who was in the operating room, and this was the third time she's been sent home because her blood pressure was too high. I don't know if you noticed that when you go to have surgery, the anesthesia people, they will not let you through that door if you're not perfect. If your blood pressure is up, or your heart rate is too high, or your blood count is too low, they say, nope, we're not doing it, go home. So this lady was being sent home for the third time. Every time I tried to do her DNC procedure, she was being sent home. So the third time, I turned to the anesthesiologist in the room and I said, wow, why don't I just do acupuncture anesthesia on this poor lady so we can get this procedure done? But I was joking. And she said, is there such a thing? I said, yes. She says, will you do it? I said, yeah, you're the one in charge. I'll do it. And I did acupuncture anesthesia on her. And I did the procedure on her. And I diagnosed, she might well be listening because she's still alive, I diagnosed cancer on her. And the rest again is history. She went to Sloan Kettering and they took care of her. But that diagnosis would not have been made because she kept being sent home because it was a very high risk. She was 70 at the time, with very high blood pressure and a unstable situation with her heart. And because the acupuncture was so non-invasive, so easy, I got her to relax and I got to do it pain-free. So that's one of the still amazing ones. And then there are the little ones, like people who come with a massive migraine headache and you put the needle in and they say, oh, that's gone, you know. I get that all the time. And then you have, there's so many.
In the chat room, Mary asked, said, do you feel acupuncture is suitable for infants and small children, addressing asthma, for example?
Okay. Um, what your caller has to understand is that acupuncture up to recently was not even accepted or embraced. I don't know if there's such an entity as pediatric acupuncture here in the United States. You know, I personally have done acupuncture on children because I find it's very safe. They have very tiny needles, and one small needle can do a lot for a child. I don't know what the explanation is, maybe it's the size of their body, but I find that acupuncture on children is so effective. They respond so amazingly and quickly. So yes, I personally have done it, but I don't know if in general you're going to find people that do it. And I am not a pediatrician, so when I do it, I would do it for select people like family friend or something.
Mary asked again, please tell us more about your successes with stroke patients showing partial paralysis.
Well, my mother was a stroke patient, and I used acupuncture to take care of her a lot. She was given a year or less to live, and she lived 12 years. That big. But she had the luxury. I used to say to her, how much should I charge you for this? You're getting acupuncture every day. Nobody can afford this. And she just looked at me and like, go on, girl, do your keep doing your stuff. But I used to do acupuncture on her daily, it's every other day.
Do you remember your first acupuncture patient?
My mother.
Your mother. What was that like,
My
seeing
poor
her
mom.
respond positively?
Well, when I just was training in acupuncture, you know, I was licensed. And you know, in our business, we're things are very strict. You have to be licensed, you have to be covered by malpractice insurance. So I didn't have any of that stuff when I was training, so I used my poor mom. And she got a lot of relief with her arthritis and so on. And then I did a lot of friends. And then little by little, after I became licensed, I started to do it officially on patients. But I can't remember who my first real patient was. But mostly friends and family members is what I use it on first.
Let's take a quick break. When we come back, I want you. We're back with Dr. Monica Martin. Dr. Martin, the question I asked before the break was, can you describe a typical day at work for you?
A typical day. You see, Selwyn, I don't have a typical day. So I have different days. I could select one day for you.
Okay.
Okay. And I'm not delivering babies at the moment, but during those days that would be another kind of a day.
Mm-hmm.
Those days were very interesting because when you deliver babies, you're not your own. And I remember I used to be so busy in my office and somebody would go into labor in the middle of the day. And then I had to literally run and leave patients in the office. You know, so, but I don't do that now. A typical day for me, it may be that I have a patient who has to go to the operating room for a big surgery, let's say a myomectomy, or any other abdominal surgeries, ovarian cyst, any other stuff. What I do, I try not to have office hours on those days. I used to, but I don't anymore. Many years ago I stopped that. And I would just get myself ready, you know, and really take care of myself, make sure I get a good night's sleep, and have a good nutritious breakfast, you know, take my vitamins and relax. And then I go in late morning to start my surgery. I don't like to start my surgeries early morning. I'm not an early morning surgery person. And then I would go in and just work. And when I'm in the operating room belongs to me and my patient. And it doesn't matter who thinks I'm slow. Because sometimes when you have to do detail, you get to be what people think of as slow. But you're not really slow, you're being detailed. I told you earlier that you'd have made a great surgeon, Selwyn, because I see that you're into detail.
I have to be.
So, you know, I would go through my case, and depending on what the woman's needs are,
Mm-hmm.
that's what I would do in the operating room. And if the case finishes earlier than I had planned, goody goody, I go home and I relax. I might go see a show or a play, a Broadway play at nights. I try to get a little entertainment in, or I do something relaxing. But if the case takes me all night, all evening, where I need to stay and watch the patient, because sometimes you have things where you can't just go home. You have to make sure the patient is stable. Because I hate to go home and they call me back in. So this is one of the typical days.
Mm-hmm. Mm-hmm.
Then you have the typical day that's just office. We're in the office and you work. You see different types of cases. So you never get bored. And
Heather asked, please tell us about some of your work with acupuncture facelifts.
well, acupuncture facelift. I know that's a thing that's been embraced by a few of the celebrities actually do it now. And I've done acupuncture facelifts just like privately with some friends or one or two select patients. But I haven't really gone out there to say I do acupuncture facelift. But acupuncture facelift, it involves the same basic principle of acupuncture, which you want to nourish, get more energy to the face, and get the blood flowing better to the face, so you have more energy in your face. It's nothing mysterious, but because of having so many sick patients, I tend to not do the cosmetic thing too much.
Is there a favorite gadget that you use? What are the tools of your trade? And is there a favorite gadget?
The tool of my trade? You amaze me with the questions.
just, I am thinking needles, but I mean there might be something else. I don't know.
Well, with acupuncture, we have other aspects of acupuncture. We have a thing called cupping, which I don't do much of, but I did a lot of that when I was in China. Cupping, which is a technique, it's an offshoot from acupuncture where you actually get the blood to flow more to various areas and thus improve pain. It's a form of pain management also. And but that's not, I wouldn't consider one of my favorite gadgets. One of my favorite gadgets actually is just the plain acupuncture needles. I have different sizes that I use for different areas of the body and for different needs, different patients, different body types. So
have you ever had a patient scream out of fear before they got the needle and before you insert the needle? And
yes, I've had that. Where they scream out of fear and then sometimes they fall asleep and I say, what happened? Why aren't you screaming?
You put them to sleep or they just...
Yeah, they relax. Yeah, because acupuncture is also relaxing.
Wow. I must try it sometime.
Yeah, absolutely. You can.
What unique challenges and rewards come from being able to use a combination of both Western and Eastern medicine?
Well, the Western doctor, which I am, and which a lot of people are, gets a lot of satisfaction from their work in general.
Mm-hmm.
There's a lot to be said when, for example, somebody comes in with a massive heart attack or somebody comes in with an aneurysm and a physician can get that person back to work. It's extremely rewarding. So I think all aspects of Western medicine can be rewarding. There are some sad parts, which of course we know about, but the people who just do Eastern medicine alone, they get a lot of satisfaction too. Because I was in China where I work with this Dr. Lee and his wife, another Dr. Lee. She's a Western doc across the street, and he was totally acupuncture. And just working with him was so fascinating to watch him I would have to say, heal these stroke patients. It was almost miraculous. So I say all that to come back to the combination. The combination of Eastern and Western medicine is like a wow. It's very, very rewarding. Yes.
Looking back on your medical career,
Yes.
do you have any regrets?
No regrets. Medicine does, the whole medical world, they do a lot of things that make me unhappy sometimes.
Mm-hmm.
But the art of medicine itself, I have absolutely no regrets.
Do you ever wish you had chosen another profession?
No,
No.
absolutely not.
I want to shift back a little bit to gynecology. What do painful heavy periods mean?
Painful heavy periods could mean a lot of things. Painful heavy period could come from poor eating habits. Painful heavy periods could come from actual diseases. For example, endometriosis, adenomyosis, pelvic inflammatory diseases. Am I losing it?
No.
Okay.
No. No.
But these diseases can cause a lot of pain and a lot of bleeding, well, especially endometriosis and adenomyosis. And fibroid uterus can cause a lot of bleeding. Most of the time, fibroid uterus, the bleeding is not painful per se. However, there comes a point when some of these fibroids, which you can picture these like little stones or little demons, as I call it, sitting in the uterus, and they become so large that they, as we would say, they outrun their blood supply, so to speak. Because every single fibroid, as I always tell my patients, they set up their own plumbing system. Each fibroid has to get blood. So, because there was never any blood supply for them before, but somehow when they come in you, they have their own blood supply so that they can get oxygen, so they can grow. So sometimes when the fibroid outgrow their blood supply, that area where there's no more blood coming becomes broken down, as we say, necrotic. And because there's no oxygen, that whole area, there's so much pain from those fibroids that people have had their appendix removed by accident. They have a pain on that side and everything looks like an appendectomy. I have been called when I was a resident. I was called quite a few times into the operating room to assist another doctor who went in because he or she thought it was a ruptured appendix or some other, bowel problem, and then sometimes I had to check in as the chief resident and clean up what they just did and then do the GYN part because it was a GYN problem to begin with.
I know one of our greatest challenges, perhaps for many women, are fertility issues today. Some women try to avoid pregnancies while others try to get pregnant. What is your take on women's fertility today?
Well, women's fertility is very, very complex. There are women who just choose not to have children. And there's nothing wrong with that, if this is what you desire. But there are people who would love to have children and just can't because of numerous reasons. Early in my training, I remember we used to think that infertility was a woman's thing. Then as time went on, we said, oh, it's mostly women, but it's some men. But now we realize it's probably 50-50. Where a lot of the infertility is due to the man. And a lot of times the women just keep going to the doctor and they get all these laparoscopies and they get all these procedures done and marriages even break up. Being in practice so long now, I'm not just talking from the book, I'm talking from experience. Marriages have broken up because it was thought that it was the woman. It turned out it was the man. Sometimes a man is not producing enough sperm. And sometimes a man, depending on the job he does, some men do jobs where they sit a lot. Some men do jobs where they drive trucks. And a lot of men who drive trucks, they end up being infertile because the heat, there's too much heat in that scrotal area. That area is supposed to be cool.
Oh.
That's a little refrigerator for the sperm.
Didn't know
Scrotum
that.
is a refrigerator. I'm exaggerating when I say refrigerator. It keeps the sperm cool.
Yes.
So when men sit a lot, drive trucks a lot, and do a lot of them end up with low sperm count.
Becomes an oven.
So they're infertile, and a lot of times now, the minute a woman comes to me with infertility problem, the man has to get involved right away. So we know from the beginning.
Karen G asks, do you find that women of color has more of an issue with fibroids? What do you think causes fibroids?
It's funny. I worked in Africa for a little while when I was in medical school. I was doing tropical medicine, but I got to see a lot of women, and I ended up, since I love GYN and I wanted to do GYN, I was kind of drawn to the GYN era, even though I was supposed to be doing tropical medicine, but I did a lot of GYN. And it's fascinating. Now, when I was in Africa, I don't know about now, but when I was in Africa, I didn't see fibroids. I don't know if that's a real fact or what, but I just never saw it. So then the issue comes up, well, we're not saying, yes, it's due to this or yes, it's due to that. Officially, there's no explanation, so to speak. But there's no question that the diet can play a role. And genetics, heredity can play a role. The way people eat is so wrong sometimes that If you think about these poor organs sitting inside, you wonder how they must cringe when they see some of the kind of food that people put in their bodies. I'm sorry. The organs, they cringe. Did you know that? You didn't know organs cringe?
No, I didn't know that.
Like the liver and the kidney, they cringe a lot.
Dr. Martin, you're funny.
But anyway, the things people eat.
Right.
And as I said before, fibroids are very dependent on a hormonal stimulus. Because, for example, when a woman comes to me, or most doctors, with huge fibroids that are so big, they're inoperable. We can't really operate on them. They're massive. We have to shrink them down with a drug that blocks estrogen. The drug that we use to shrink the fibroids, Lupron, actually blocks estrogen. That is why when we put patients on it, it stops their period for a while because it blocks all the estrogen. And when you block that estrogen, by a miraculous reason, the fibroids start to shrink. And you say, okay, Mrs. Jones, your fibroids have shrunk enough for me to operate. I can take you down to the OR.
Wow.
So that tells you that a lot of the foods we eat probably have so many estrogen contamination in it. But I really don't have the concrete answer, but those are just ideas.
G asks, is it true that thyroid dysfunction can cause infertility? How can women find out whether that is their problem, and what is the recommended treatment?
Well, the thyroid, right? Or
yes, thyroid.
Mm-hmm. Well, the thyroid, is the organ that sits right under your neck. And that thyroid is a very, very potent hormonal organ. It controls a lot of the hormones in our bodies. Most of the hormones that are running through our bodies are controlled by the thyroid. So naturally then, infertility can be one of the reasons. I screen all my patients for thyroid. Every single patient that comes through my door gets screened, but that's not a requirement. So people have to be educated. That's what I talk about, knowledge. You have to have some knowledge. You have to ask your doctor to screen your thyroid. It's a very simple test. The same blood that the doctor draws, just add the word thyroid and you get the same. You don't have to do another blood test. The same test.
Same test. Karen G said, I'm sure they cringe. I cringe when I see what some people eat.
See, somebody agrees with me.
What was the most humbling lesson you learned as a physician?
Wow. The most humbling, there have been a lot of humbling lessons. Some of the humbling lessons I learned as a young student, doctor in training, was no matter how much you have this knowledge, and no matter how much your colleagues have this knowledge, because those days I didn't have that much knowledge, but you see your big time doctors who were there with you watch a patient still die, or you watch a baby still die. That's humbling. That's like, wow, we couldn't save that child, or we couldn't save that person.
What are the most important things that women can do to protect their reproductive health?
Well, women have a lot of power over their reproductive health. Okay? Assuming you're not born with anything genetic, anything that causes, like some people are born without a uterus, some people are born without cervix, some people are born without vagina, and some people. Once you have a normal reproductive system that you're born with, you're really in control. And so, taking care of yourself, good hygiene, and then back to what I said earlier about being careful of your sexual behavior and protecting those sexual organs, which are very vital to your childbearing. And we can't stop talking about proper eating and proper hydration of your body. A lot of people go without drinking water, and that's also very important for the reproductive system.
What are you most proud of?
What am I most happy with? I don't know if I'm proud. I'm Yeah, okay, I'll say it. I'm proud of the fact that I pursued what I wanted to pursue.
Hmm.
Um, as the saying goes, Shakespeare, my Shakespeare friend I told you about, she used to be always reciting these poetry, these Shakespearean things. And one of the things which most of us know is to thine own self be true.
If you could share one thing with a medical student about your experiences, what would it be?
My experiences, or
Yes, one thing with a medical student about your experiences.
okay, you're a medical student, you want to become a doctor, you have to, I don't know if I understand your question, but I'm just going to address it this way. You have to realize the importance of the patient, and you have to respect your patient. That respect for your patient can lead to a whole lot of good stuff. Because when you respect your patient, you're gonna try your best to give them the best kind of care. You're gonna really dig deep to try to help them. And so when you have that respect for your patient and for your work, because your work is an art. Most artists don't make a lot of money when they're starting out.
Mhm.
If you go into medicine because you want to make a lot of money, you may make a lot of money, but that shouldn't be the reason why you're going to medicine. Because medicine is a really true art form, and you have to do it well, and you have to, even if you don't love it, you have to at least like it, so you can have success in what you do. So, in the times when the money don't come in, you still love it, and when the time when the money come in, you still love it.
Looking back at your accomplishments, if you could go back in time, what would you tell the 15-year-old Monica?
15-year-old Mike.
I'm sorry.
No, that's okay. It's a good question, but you just amaze me with these questions. But the 15-year-old Monica was you know being a 15-year-old, but fantasizing about being a doctor. And what I know now, I would tell her that first of all, you don't write prescriptions in Latin. It's written in English. It's just that doctors' handwriting is so terrible. Maybe that's why people thought they were writing in Latin.
Do you have a favorite music?
Favorite music
Mm-hmm.
or song?
Huh?
Music?
Yes, type of music.
Type of music? I love a lot of different kind of music. I love classical music. I
Uh-huh.
love jazz. I love religious music a lot. Um, gospel music. Uh, I love classical music because it has such a discipline to it. So sometimes I would go and try to enjoy just listening to classical music, because classical music, um, when you look back, most of these music were written back in the 1800s, and they were so much into perfection and getting it right. Yeah, but then I sometimes love to listen to you know, the crazy music that just make you.
What is the last time you laughed unusually hard?
Yesterday,
What do you look forward to doing on weekends?
well, I used to travel a lot, which I don't travel anymore, but I used to run away on weekends to Jamaica or to the Bahamas, things like that. But when I stay home, I like to just listen to good music. Sometimes I watch nonsense on the same TV that I talk about.
Finish the sentence. I look forward to Sunday evenings to
Just relax.
relax. Talking about going away and going on vacations in different places. If it's a warm summer day, you want to get away. So you go to your favorite spot and you have a book to read and you're listening to your favorite song and you're drinking your favorite drink. Which place will this be? Which music, which song will it be? Which book will you be reading? And what will you be drinking?
Wow.
I'm I'm not coming for acupuncture anytime soon. I know.
No,
That I know.
no, I will take revenge on you like that. Wow. But I've traveled a lot,
Uh-huh.
and still my favorite place to go is Jamaica. That place is just magical. And there's certain places in Jamaica I like to go on the north coast and relax and listen to music. Most likely some kind of reggae music
Reggae.
I'm listening to,
Any
which I also love, by the way.
any specific book would you be reading?
Probably not anything specific.
Okay.
Because most of the time I take a book, I end up not reading it. Because I read so much anyway. I just sit and watch.
And what would you be drinking? What
Well,
would be your favorite drink?
my favorite drink. Oh, there's so many favorite drinks, but
It's a hot day and you're relaxing.
relax with a little rum punch.
Rum punch. Okay.
Pina colada.
Before I ask you my last question, in the chat room, Karen G said, I have a friend who suffers from polycystic ovarian syndrome, and today I read GMO foods can be part of the cause. Can you enlighten us on this syndrome?
Well, they really have not come up with reasons for polycystic ovarian, right?
Yes.
Polycystic ovarian disease. I really have no nutritional concrete advice. It's just that disease happens to be one of the sad diseases for the woman. As this young lady may or may not know, can be masculinizing because it can create male hormones, and obviously it creates infertility and disturbance in the menstrual period. I don't think we really have an answer as to what causes that disease, to be very, very honest with you. But any kind of nutritional precaution taken is always a good thing, but I officially cannot say, the main reason.
Question I ask all my guests.
Yes.
What makes you laugh out loud?
Sometimes I watch silly things on TV. Can I tell you the silly thing I watch?
Yeah, sure. You're the boss in that chair.
No.
Wait,
That's too silly.
why not?
That's too silly. What makes me laugh out loud? Let me jump to something. What makes me laugh out loud? Sometimes a friend will just say something and it just tickles your funny bone. You just can't stop laughing. Sometimes people say things to you. You ever experienced that?
Yes.
And they didn't mean for it to be funny, but it's just so funny.
Very true.
Yes.
Very true. Very true. Well, I have to say that time was kind of short, right?
Yes.
I know you'll be coming back.
Okay.
I would love to have you back to
It's very pleasant.
to educate our audience more on obstetrics and gynecology and acupuncture and so on.